Thursday, 12th of March 2020, and it's not pandemic. We have Black Mirror level Eurovision contest in global level by counting the numbers we have with COVID-19. And I have had never such an opportunity to see how governments and their societies and their people behaves, how the society's health systems work, and how willingly governments give information to their own citizens. So we are kind of seeing in some sense some contest here. And yeah. So it's pandemics. We have here in Finland a press conference in 20 minutes, so I start this, and if it starts while I am doing this, I cut it and do the rest later. So we have never seen pandemia with coronavirus disease.
We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. Communicate with your people about the risks and how they can protect themselves. This is everybody's business. Find, isolate, test, and treat every case and trace every contact.
Yep.
Ready your hospitals. Protect and train your health workers. And let's all look out for each other because we need each other. There has been so much attention on one word, and you know that. Let me give you some other words that matter much more and that are much more actionable. These are prevention, preparedness, public health, political leadership, and most of all, people. We're in this together to do the right things with calm. We're in this together to do the right things with calm and protect the citizens of the world. It's doable. I thank you.
Yes.
Thank you very much.
There were nice information. I perhaps would like to put some text there. Would be easier that way. And then there was 1950.
Right now in Iran, there is a shortage of ventilators. There's a shortage of oxygen. And clearly, and you've seen this in Italy and you've seen this in other countries, what happens at this stage in an epidemic that's intense, that's generating a lot of severe cases. As of this morning in Italy, there were nearly 900 people in intensive care. That requires a huge health worker commitment. To take care of intensive, really unwell people can often require 2 to 3 medical staff at one time, all in protective gear for hours and hours. Number one, they use up a lot of protective gear. Number two, they become exhausted very quickly. And our concern for our colleagues in Iran and in Italy right now is actually the caseload, the demand on the health workers, and the dangers that come with fatigue and potentially shortages of PPE. So we all must move quickly. While some countries are affected more than others, and yes, we can get into the game of whether governments are doing enough or not enough, or whether things were better planned or should be planned. The fact is, right now, in countries We have frontline health workers who need our help. We have hospitals who need our support. We have people who need our care. And we need to focus on getting our frontline health workers the equipment, supplies, and training they need to do a good job. So I think we need to, in that sense now, all focus on the job at hand. We can work out after the fact, could we have done it better, or who's at fault, or who's to blame. We really need to focus on the word that the Director General has been using for weeks: solidarity, getting the job done. We need to move now. Iran and Italy are in the front line now. They're suffering, but I guarantee you other countries will be in that situation very soon. So we all need to show that solidarity for each other. We're focused on practical support to Iran, and we will continue to provide that and working with international partners.
Yes. And then again, same like ideology about health. Health systems 26. Nice timing. There.
If you do not try and suppress this virus, it can overwhelm your health system. So there have to be very strong efforts made to suppress infection, to push the infection back, because at the very least, it will take the pressure. It will allow and flatten the curve and allow your health system to remain in control and achieve some success in reducing case fatality. So from that perspective, I think it's very important that we use our words very carefully from here on in. With regard to Spain, Spain has a number of cases have accelerated very, very quickly over the last couple of days, as have France, as has Norway, as has Denmark, and as have a number of European countries. So it's very important that countries in the European Union and in Western Europe really do look at what their current control strategy is for this disease, and to assess whether the efforts they're taking are good enough in terms of suppressing transmission and pushing back the virus, and then obviously preparing their health systems to cope with the cases that do occur. All countries need to review their strategies right now.
Mm.
Yeah, thank you. I would be happy to add to...
And then... Forty-three, something about tests, how important they are. Hmm? 43:14. Ooh, there's that.
In contact finding. What you're seeing and testing those individuals. Testing is important to be able to know who is a case and who is not a case. And so testing must continue. Isolation of patients, treatment in hospital, care for those patients. Isolation and quarantine of contacts, separating them from other individuals so that they cannot pass the virus onward. This is case and contact finding. Mobilizing your population. Using every person in your population that can help fight against this virus, knowing what each individual can do, not only to protect themselves from getting infected, but by protecting themselves from getting infected, they're preventing the onward transmission, which may lead to another vulnerable person. And so these fundamentals, making sure that your labs are ready, making sure that your hospitals are ready, triaging your patients. There's a difference between what you need to do for a mild patient and what you need to do for a severe patient. Making sure that patients who require more advanced care are put in your hospitals, and having a plan for those that are more mild, those that don't require oxygen, don't require respiratory support. So what we've seen successful in many countries are these fundamental applications of basic public health measures: hand hygiene, respiratory hygiene, social distancing, assessing your own risk and seeing how you play a role in this.
There's also
Yes, and then about contacts. 45.
expensive business of contact tracing. Contact tracing is not an expensive business. Contact tracing is a very basic public health intervention. It does involve interrupting the lives of a small proportion of the population in terms of quarantine of contacts, isolation of cases. And that's very tough on those individual families. But please, tell me if that's less or more expensive than social distancing measures that include locking down whole areas, cancelling all sporting events, cancelling all religious events, closing schools. Which is the more costly? And I think there's a misunderstanding here that in some ways the public health measure of case finding and contact tracing is something that requires a massive effort. Teams in Congo were chasing 25,000 contacts a day in the middle of a shooting war and doing it every day under fire. And they did it. So I think we need to reach a bit further into how far can public health measures be used? How far can we push contact tracing and case finding and quarantine of contacts? Because countries like Korea, countries like Singapore and countries like China have shown that sticking harder to that strategy has resulted in benefits. We can't guarantee that that will result in a benefit everywhere. All we can show you is that that has resulted in a significant benefit in the context of those countries. And is it worth not investing as much as you can in that until you're sure that it's not working? But as the DG said, be comprehensive, be also ready, prepare your system, and be ready to deal with the cases that in so many cases will inevitably occur. But at the very minimum, you'll suppress the epidemic and potentially reduce the number of cases per day that walk through or are wheeled through the door of the hospital. It's a very simple equation. And I think we need to maybe get away from these arguments of assuming that case finding and contact tracing is very expensive, it's very labour intensive, I've been told. I've been doing it for 25 years. I'd much rather stick with contact tracing and case isolation than necessarily shut down whole societies. I would find that much more difficult to sustain. So I think there's a degree of assumption here that we need to avoid. This is a new disease. It's a coronavirus. It's not influenza. We need to learn the lessons that we're being shown by the virus, and we need to move on to a comprehensive strategy for its control.
And I need to add to this because this is a really excellent question. You know, what we didn't also mention is what countries have done using an evidence-based approach. They're constantly learning about this virus. They're constantly learning where is it circulating, who is most affected, and they're filtering that back into their approach and making a more tailored, prioritized approach to where the effort is needed most. Every country, the DG has said this, the outbreak in each country is not uniform across the entire country. Sometimes there are certain clusters that are happening. There are certain cities that are more affected. Be creative, be prioritized, use the evidence that you have to actually mobilize your forces. We've seen some very creative approaches of looking at contact tracing, where they've utilized different populations to help them do that. We've seen some countries use technology to help them with contact tracing. There are a lot of tools that are out there. It's not a matter of tools, it's a matter of will. It's a matter of how do we use our best efforts to drive this down. There's no excuse to say that we cannot do this. We have shown in many countries, not we, countries themselves have shown that they are able to do this. And we must push countries, all of us, to fight as hard as they can to suppress this virus. Because by doing so, you are saving lives. By doing so, you are buying more time for your hospitals to prepare. Having a large number of hospitals overwhelm your ICU is incredibly damaging, and more people will die. So do everything that you can to be as aggressive as you can in these early cases.
Thank you very much. And I'm really sorry for journalists.
Yes. So we have, yesterday was around 59, and now we have 87 cases. Let's refresh the page here. And there are now 109 confirmed COVID-19 cases in Finland. Our government, as I watched our government press conference just now, said that every gathering above 500 has to be cancelled because of COVID-19. They are asking us not to travel at all. And our government with our banks are going to help smaller businesses to survive from this, and they are creating programs especially to COVID-19 to search information and follow the information at live, so to speak. So take care and wash your hands, don't touch your face. Let's love ourselves from distance. See ya. Bye.